Chapter 4, Nursing Process and Critical Thinking. We are going to explain the use of the nursing process, identify the components of the nursing process, compare and contrast the terms critical thinking, critical reasoning, and clinical judgment, identify the steps of problem-solving process, and list the steps used in decision-making. We're going to identify ways to improve critical reasoning skills, apply the critical thinking process to real-life problem, discuss the use of critical thinking in nursing, and apply nursing process to patient care assignment. The nursing process was developed in the 1950s to describe the independent role of the nurse in providing patient care. The goal of this systematic, dynamic process are to explore patients' health status, identify actual or potential healthcare problems, and determine desired outcomes, deliver specific nursing interventions that will solve the problems and promote health, and evaluate caregiving and determine whether outcomes have been achieved. The construction of a plan of care for the patient is a collaborative process among the nurse, the patient, and other health team members. Patient input during the planning stage results in more success with the plan of care. The key components of the nursing process are ADPIE, assessment, diagnosis, planning, implementation, and evaluation. The nursing process is similar to other methods used to organize tasks in daily life. In planning a week's meals at home, the goal is to supply each family member with good nutrition. The assessment or data collection phase involves surveying the supplies on hand needed for food preparation. The data are analyzed to determine what must be purchased at the store, to plan specific menus, and to plan for deviation from normal meals, such as school lunches or quick dinners before a child's basketball game. Implementation would include the shopping, preparing, and serving the meals, and cleaning up afterwards. Evaluation is performed to determine whether the plan was successful. Did the family members eat what was served? Was there too much left over? Was the expected outcome of balanced nutrition for each family member met? If not, should the plan be altered for next week? That's a perfect example of the nursing process. Using hypothetical examples of patients with prevalent health conditions such as diabetes, congestive heart failure, or some form of cancer diagnosis, we can collect, organize, and document and validate a patient's health data. So if you think about those different types of disorders and diseases, we can think about what sort of data we're going to need to collect. So once again, assessment is when you're busy little squirrels collecting all your nuts, collecting all your data that you're going to need so that you can develop your care plan for this patient. Only registered nurses are to develop a nursing diagnosis. LPNs use the nursing diagnosis and interventions plan by the RN to provide patient care. It is important to know why the RN develops the nursing diagnosis in order for you to suggest changes based on the patient's condition. In the planning stage, it's a series of steps in which the nurse and the patient set priorities and goals to eliminate, diminish, or control identified problems. Goals should be stated with specific outcomes. The nurse and the patient collaborate to choose specific interventions to enable the patient to meet the specific outcomes listed in the plan of care. It's very important that the patient be involved in the planning stage of the nursing process. Remember, implementation should equate to interventions. Appropriate documentation of interventions and patients' responses should be documented when they occur. We are going to carry out our interventions that we made during our planning process, and some interventions may be delegated or carried out by other members of the healthcare team. In the evaluation stage, we're going to evaluate our nursing care plan. We're going to be assessing the patient to evaluate their response to the nursing interventions that we provided, responses compared with expected outcomes to evaluate whether the outcomes have been met, and based on those evaluations, the nursing plan of care may need to be changed. When we talk about critical thinking inside the clinical setting, we call it clinical reasoning. Clinical reasoning is necessary to make reliable observations regarding health status and to draw sound conclusions from data obtained from the patient and from other sources. Good decision making is choosing the best actions to meet a desired goal and is part of the critical thinking process. So we want to define the problem clearly. We want to consider all possible alternatives as solutions. We want to consider outcomes for each alternative. We want to predict the likelihood for each outcome occurring. And finally, choose alternative with the best chance of success and the fewest undesirable outcomes. Practicing careful consideration of problems and purposeful thinking rather than random thinking will help you develop these skills and attributes. Critical thinking requires the use of facts and details, and it assists in the formation of active resolutions of problems. During assessment, we're going to be collecting, organizing, documenting, and validating data about a patient's health status. Assessment data is obtained from the patient, the family, the primary care provider, diagnostic tests, and information about the patient from other health professionals. During implementation, equipment and supplies are gathered and procedures are thought through before beginning them. Responses to interventions are also assessed. If the expected outcomes once again are not achieved, the plan of care needs to be reconsidered. Question number 1. Which of the following is an example of the nurse's statement that reflects using the scientific method in the nursing process? Number 1, I believe that this patient is getting depressed. Number 2, the patient doesn't look right to me. I think something's wrong. Number 3, the patient's husband told me that she is very uncomfortable. She's feeling very uncomfortable. Number 4, the patient reports more pain than yesterday and her blood pressure is elevated. The answer is number 4. Reporting more pain than yesterday and an elevated blood pressure reflects using the scientific method in the nursing process. The nurse identified a problem of pain, hypothesized that it was greater than the day before, and collected data to evaluate its reality. Believing the patient is depressed or thinking something is wrong reflects intuition. Speaking with the husband reflects information gathering, which may be used in diagnostic reasoning. Second part of chapter 4, we're going to explain the basic principles of setting priorities for nursing care, list factors to be considered when setting priorities, and use critical thinking to prioritize care for a patient assignment. Nurses must be able to prioritize the tasks assigned to them. Prioritizing patient problems is usually based on the adaptation of Maslow's hierarchy of needs. So when we are putting our priorities in order, we're going to be putting them in the order of importance. So our highest priority is our life-threatening situations. Our medium priority are problems that threaten health or coping ability. And our lowest priority are problems that do not have a major effect on a person if not attended to that day or that week. If a nurse is feeling like overwhelmed or um, kind of out of sorts, the nurse must assign some tasks to others and discuss with the supervisor. So that is part of your job. You're going to need to organize your workload very well. Priorities are going to change constantly. You're going to have to be somebody who thinks quick on your feet and is able to prioritize and change your plan as the night progresses or as your shift progresses or day progresses if you're a day shift nurse. You want to maintain an organized workload by writing out a worksheet. You have to list major tasks that you need to accomplish first and prioritize those. Be flexible and frequent when you're reordering your tasks. So you're going to have to reprioritize and reevaluate at least every 2 hours during your shift. That's part of your job. You are going to have to be able to adapt to change. Know when to ask for help and when to delegate tasks to others. Again, just emphasizing that. The nursing process is a way of thinking as well as organizing. The nurse is constantly gathering data and evaluating. Question number 2. Which of the following nursing actions is the best example of problem solving? Number 1, requesting the IV team to start an antibiotic drip on a patient with a history of being a difficult stick. Number 2, offering to call the kitchen to provide an alternate breakfast for a patient who does not like a cooked meal or cooked cereal. 3, trying several difficult wound dressings to determine which one the patient can apply the most effectively. Or number 4, calling for another pain medication order when the current drug results in the patient experiencing nausea. Number 3, this is an example of critical thinking strategy of problem solving. The nurse gathers information by using several different products and then uses the information to determine which will work best for the patient. Effective problem solving involves the examination of alternatives. While requesting the IV team solve a problem, there is little critical thinking needed because it would be understood that the IV team would be called under these circumstances. Calling the kitchen solves a problem. There is little critical thinking needed because it would be understood that the kitchen would be called under these circumstances. Calling for another pain medication order solves a problem, but there is little critical thinking needed because it is understood that the provider would be called for a new drug order.